For more, I'm now joined by Dr. Anahita Dua, a vascular surgeon, also the founder and chair of Healthcare for Action. Anahita, thank you very much for joining me today.
It's such a pleasure. Thank you for having me.
All right, let's start with the Obamacare and the unknown future of those subsidies, making costs affordable for Americans. At this point, open enrollment, it's already underway with the government shut down without that extension for those health care tax cuts. So for the Americans out there who do use this government program, how should they actually be approaching their decision making this year?
Well, the most important thing is to make that decision, because while we're waiting for Congress to act and there's a lot of turmoil going on, it's really important that if you're part of this program, that you go and enroll now, because once January hits, you won't be able to enroll anymore. And waiting for Congress to do something right, we might be waiting for a long time. So the most important thing is do not let that coverage lapse, no matter what's going on.
Yeah, this is an important decision every year at this time. So while Democrats are still attempting to extend those subsidies, the clock is running out fast with no guarantee that it actually gets done before the end of the year. According to the Congressional Budget Office, if this doesn't change, then the average of 3.8 million people per year will drop their coverage, becoming uninsured. What is the actual impact of that growing number of people that do become uninsured in this instance?
There are two huge things that will happen. Number one, if almost 4 million people are not insured, what's going to happen is they're going to continue to get sick. Not having insurance does not mean that you don't get sick. And those people then will overwhelm the ER system. And unfortunately, even though that part is okay, I'm okay with working late and taking care of those patients, the problem is that they're going to come in too late. And that's the second thing that's going to happen. They might come in after that breast cancer is already spread, or might come in after that pneumonia is no longer something I can manage, and they can literally die, which has been out there in statistics already, that if people are not insured, we know what happens to our population.
Yeah. All right, let's take a look at the alternative. President Trump also sharing some ideas of his own, a potential plan, so to speak, in which he's recommending that lawmakers replace those federal subsidies for ACA premiums sent to the private health insurance with actual money sent directly to the American people. So this idea isn't necessarily fleshed out yet, or at least the Trump administration hasn't told us what the plan is. But what do you think about this idea in general, putting money in the pockets of Americans instead of the health insurance companies?
It makes no sense. And the reason for that is because the reason that costs are high are because we don't have drug transparency, price transparency. It doesn't matter how much money you put into the American's bank account if it costs $20,000 to get an MRI. The problem is that it costs $20,000 to get an MRI. And because we have uninsured people, we have Medicaid and Medicare, and we have people with quote-unquote good insurance, that is what the market forces are that confuses how much it actually costs when you go to the hospital. And actually, that is what needs to get fixed. And that cannot get fixed in 2 months. Healthcare is not a tweet. And also, I'll also say that health insurance does not mean that you have health care. Many people have health insurance, but they don't get the proper care because things are not covered. So unfortunately, this plan not fleshed out is the understatement of the century. It's not even thought through. I think he might think that this is the way, or if I just give you more money, you can get that health care. But that is not the way that it works. What we really need is doctors, policymakers, people who do this to sit in a room, bipartisan, and make a decision and plan about how to deal with this. The Obamacare subsidies are not good enough. They're basically coupons. What's the point in coupons? I need to bring down the cost of whatever it is.
Right.
And that's what we really need to focus on in America.
And $2,000 in your pocket most certainly is helpful for millions of Americans, but at the same time, it's just a drop in the bucket when it comes to the health care needs that they have year in and year out. That's Dr. Anahita Dua. Thank you very much for your time this morning.
Thank you.